Hello, I'm Melissa Fuller with Shape of the City, and we are at the Bridge, and we're going to learn about some of the programs that they have going on, all the amazing projects, and I am here with three amazing women. I am here with Mary, Hillary, and Bonnie. Give us an overview. What is the Bridge? What does it do? What is its mission?
Sure, thank you. Well, we're the Bridge Behavioral Health. We started in the 1980s as Cornhusker Place, and we're often known for civil protective custody, but we're known for so much more than that. Medical withdrawal unit, respite care, residential recovery. So we serve a vast number of men, primarily 21 to 40 years old, many without insurance, many who don't make a lot of money, but they come to the Bridge for the needed care that they get here, that they're not going to get anywhere else.
Perfect. Thank you. All right, Mary. Can you tell me a little bit about what you do here at the Bridge and a little bit about the family care program as well?
Sure. I am the family care counselor here at the Bridge, and I have been doing this for a little over a year now. I've been with the Bridge for over 3 years. Basically, my job entails two major parts, but a lot of other ones as well. First of all, I do family sessions with our clients and their families, and a lot of times that involves trying to set up appropriate boundaries with clients and their families. This is what I need in my recovery or for my recovery going forward, and for families to set boundaries as well. As you know, we've been going through this for a while, and now this is what we need. And so setting up healthy boundaries is one of the big things that we talk about in family session. The other part of my job that I do is set up visits for the clients, and Hillary helps me with that as well. And it's a matter of approving people for visits. So if they're going to come and visit a client, they have to go through an approval process first that we take care of.
Hillary, I would love to hear about what you do here at the Bridge. And with what you do, how is every family unique?
Yes, so I work as the family navigator, and I am the first contact for these families. Usually I work with phone calls, and families call in about their loved ones and they're in crisis, and it's really hard for them to get to a decision-making process. So I help them calm down, and we kind of discover what behavioral health care needs they need to take to get their loved ones some help.
How do you go about getting families involved?
We start out when a client comes in to the Bridge for treatment. They go through an intake process, and part of that process is talking about their families. We get releases of information, of course, and then asking them, will they have people who they want to have come and visit them while they're here? Or is there any relationship that they'd like to work on within their family? And family is defined how they want to define it. And so if they have those issues, then we talk further about, do you want to do some counseling sessions with your family in order to repair relationships? Sometimes clients need to tell their family some things that they have not ever told them before, and they feel better doing it in a family session where they have a third party. A lot of times what's happened is there's been a lot of hurt in the families due to substance use, and therefore we work to move forward out of that hurt, leave the past behind, and look at what's ahead. And so it's just a matter of that initial intake when we talk to clients about their families and what they need to make their family relationships work.
If there's a viewer out there that feels like maybe they're the person that's having the substance abuse, or maybe a family member, what should they do?
They should call here. Our services are open to everyone, even if they're not a client here. And so they can call and ask for myself or for Hillary, and we can get that started, finding out some information and then kind of where we need to go from there.
How is it that having family care helps the client in their recovery process?
So family care can help in many ways. We can do family counseling, as Mary had said. We also do family education. This is just education about anything that has to do with addiction. Any issue that you're having and you want more education. The other way is we can provide what services you need, what the loved one would need.
Are there other events here at the Bridge that our viewers should be aware of?
Yes, each week we do over a dozen 12-step meetings with the recovery community, everything from Alcoholics Anonymous to Narcotics Anonymous to a new organization called Nar-Anon, which is like Al-Anon for those who suffer from narcotics abuse. Those meetings are held here throughout the bridge, morning, noon, and night, 7 days a week, and there's a full schedule on our website. We also do a couple different recovery events throughout the year where we support those in recovery. We do a fun event second Friday of every month called Soberoki, and it's fun with all the fun you can have without the imbibing. And we have a great event coming up every fall, Tailgate Straight, where we promote how to have fun in a college football town without drinking.
College football season is a big event around here. We make sure, and we work closely with law enforcement to make sure that people who are under the influence get to a safe place during the home games. We have a nurse that goes down to the stadium with a tech, and they bring back those people that cannot find a responsible party to make sure that they have a safe place to withdraw from service or influences.
Any inspiring stories that you've come across while working here at the Bridge?
Yeah, absolutely. Family sessions, you never know how they're going to turn out because you're dealing with personalities and you're dealing with hurt, so it can be a different outcome than you plan. But it's been great to see that at the end of doing some family sessions, for example, a family who our client struggling with parents and the parents not wanting to let go of past hurts and being able to work through that together and looking forward instead of backward and planning how can we make this family work in the future instead of looking at how did it not work in the past. And so that's always a great thing to see. Got off a phone call today with someone who was very concerned about a loved one who's using and what can they do. And sometimes the news is that you really can't do anything unless they're ready for that. But just offering some strategies, take care of yourself and offer support to that person and offer assistance to help them get the help that they need and just to continue to be a friend. So.
What's that make you think?
I also can remember a phone call with a mother who was in crisis. Her son, she was scared he was going to overdose, so I took the call. I calmed her down. We figured out a plan, and she needed to call 911 if he was in imminent danger. And then I also call them 2 weeks later, and I try to check up with them, and I follow up, and it seemed that she had gotten the help that she needed, and she was very thankful for that calming voice that I gave her.
Is there anything else that you would like to add for viewers who may have questions or want to know more about the Bridge?
I would add that a lot of times what we do is we connect people with resources in the community. And so if a call comes in and it goes to Hillary, she can connect them with different resources. And we only do treatment for males. So if people are calling in about a female, we can direct them to a different treatment facility that would deal with females. And the education classes, again, that Hillary talked about are open to anybody. You don't have to have a loved one here. We would offer those to anyone.
Substance abuse disorder affects everyone. It just does. Everybody knows somebody who's affected. What we try to do here at the Bridge is remove the stigma, that it is a disease, and it is something that we can work on, that it takes a community. We are Region 5 funded, but we depend a great deal on donations, so that's always something that we look for. My job in development is to raise funds and to raise awareness of the Bridge, and so we keep going further, faster, so we can treat more clients. We also, something that Mary alluded to, but we do take walk-ins. If someone's having a really tough time and wants to quit and knows they need some help, we often get people who just walk up the elevator or, come in and ask for help. That's something that we are ready, willing, and able to help with. We also do substance evaluations. If someone wants to make an appointment and feels that they have some concerns that they might want to get some help, some advice, some counsel. So there's a lot of things we do. A lot of our information's on our website. We have a pretty active Facebook following, so we're always doing new and different fun stuff around here. It's not all, it's a serious subject what we do, obviously, but there's great things happening everywhere, and we work so well with our peer communities in the city of Lincoln, and it's just a great place to be.
Well, thank all of you guys for taking some time out of your day to talk to me, and good luck with everything.
Thank you.
Thank you.